Date on the COVID-19 pandemic here in Ghana. We'll also look at the Africa picture, the Europe picture, the America picture, among others. And then we'll look at matters arising on the figures and what have you here in Ghana. Stay with us, we'll be right back. So welcome back to our special coverage of the COVID-19 pandemic. So let me introduce to you the gentleman who I'll be having today's discussion with. I have Ebenezer Afenyi-Dansey, he's the head of the Citi Business News Desk for TV and Radio. Eben, welcome.
Thank you, Vivian.
And then I also have Selim Adonu. He's the head of features and articles here at Citi TV as well as Citi FM. Selim, welcome.
Thank you, Vivian.
Okay, guys, so let's quickly jump in. Let's look at the figures across the world. Let's start with the global figures. Whilst we're dealing with that, we can also look at the Africa or Ghanaian figures, and then we take it. So, Selim, what do you have?
Yes, so the Ghanaian figures, our latest update suggests that 12,193 people have been infected with the virus. 4,326 have recovered, and we've recorded 58 deaths. So this is how it looks like. From this time, between the last update and now, we've had 4 more deaths. And I think the matter of the deaths is something we'll delve into in the later parts of the show. And it's interesting that in the past few days, indeed, in the last 10 days, we've seen quite some huge jumps in our daily infection rates. So on the 13th, for example, that the announcement for 13th, we had 11,964 reported cases. Before that, we had 11,717. Just before that one, too, we had 11,422, 11,118. So when you look at all these, you realize that the daily numbers have been jumping on average of about 250. Okay. And that is certainly huge. When you look at what was happening in the month of June, this certainly is higher in terms of the daily infection rates. And I think this should make our policymakers and health sector bureaucrats want to sit down and see if there is anything they can do about the situation in terms of what they are telling us and how they intend to bring this under control. But from what we are seeing, it is obvious that the situation is not as we are being made to believe that the situation is under control. If it's under control, we will not be having huge jumps in daily infections as we have today. Indeed, between today and the last update, we've seen 247 new cases, and that is not impressive. When you look at the positivity rate, which is the number of infections you have in a pool of tests you do, that has also been increasing gradually. When you look at it from the 6th of June, we have 4.21 as a positivity rate. 7th June, it increased to 4.26. 8th June, it increased to 4.31. Then 4.48. Then 4.53, 4.60, 4.67, and then 4.70. So this certainly is not the best of news to hear. I expect that our health sector bureaucrats should really, assure us that we are doing something. They have the situation under control, rather than just telling us that we are doing more tests, and the more tests we do, the more cases we discover.
But do they, based on the figures we are seeing over the period, do they have the situation under control? Mind you, the figures we are seeing does not even reflect the reopening of schools and the other things to come based on the easing.
Exactly my point. The figures we are seeing are the worst we've seen so far. It's the worst we've seen so far. And we are at the highest point of active cases. I had a president last Sunday trying to make the case that we should try and be looking at the active cases instead of the cumulative cases. All over the world, we make analysis or do analysis with the cumulative cases. So I don't know why Ghana should change the rule. Of course, the active cases are huge. Everywhere around the world, people are recovering. In fact, the global figures are such that almost half of the world's population infected with coronavirus have recovered. Indeed, the African figures also suggest a similar thing. So more than half of the population, Africa or even globally, have recovered. But it doesn't appear that this is what we have. Our recoveries have not been very impressive. You know, so you know, I made a point last time about what we call the DOTS, the DOTS, which is what is used in analyzing pandemics or outbreaks, disease outbreaks. The D in there stands for the duration of how infectious the person carrying the infection could be, or that pathogen could be. The O and the D, you have no control over the D. The D is a biology. You have no control over it. The O is what we call the opportunity. The opportunity is what human behavior can address or can help. So what are the opportunities? They say don't be crowded at places, because when you are crowded at places, you give the opportunity, you give the virus or the pathogen the opportunity to spread. You know, so that is what we can do. And that is where enforcement should come in. Maybe we'll come to enforcement later. The T then means transmission. So the T depends on the O. When you present the opportunity, the virus or the pathogen will spread. It will be transmitted from place to place, and that is T. The S then means there's the vulnerability or the susceptibility of the population. So for example, if you are in an aged home, the population in the aged home is very susceptible to a condition like this. So if you put somebody who is infected with that condition there, it will spread very fast. So this is the framework we use in analyzing infections or outbreaks. When you look at all these, the only thing we really have any control over is the opportunities. So opening schools right now grants this opportunity. Opening churches grants this opportunity. And all those places where we have, you know, people massing up at, you know, provide it the opportunity to spread further. And for me, that is a bigger concern, given the fact that we don't appear to be learning. Restrictions have been eased and people have taken the law into their own hands. We need to do something really, really, really drastic to bring this situation under control. But as it stands now, the situation is not looking good. Okay,
Eben, ready to give us some figures, so then we can delve in proper into the Ghana.
The global figures basically currently is around 8.1 million. That's the rounded up figure. For the deaths, it's over 440,000 recovered. Over 4.2 million people have recovered. And the table hasn't changed much. The US still leads with over 2.1 million cases. Brazil follows. Russia comes, India, UK, Spain, Italy, Peru. The US death toll currently is 118,000 and over. Brazil has 44,000 deaths and over. So the US figure is quite high compared to all the other countries. So those are the few changes. Some of the few new cases the US has recorded is around over 140 cases. Russia, some 193 cases. The numbers are slowing now a bit in terms of the new cases. And then also the deaths for the US figures is now slowing. So those are some of the global updates. We'll look at some of the global headlines later. But within Africa, according to the Africa Centers for Disease and Control Prevention, the Africa's case count currently is over, the figure is a bit tricky with the details. So
Africa seems to be
about 250,000.
Over 250,000 cases. The deaths
about 6,800.
6,000. We are clocking almost 7,000 for deaths related to COVID here.
But you see, the interesting thing is when you look at the global figure, about 400,000 people have died. That is Africa's total figure is just about half of that. Of course, Africa is the last continent to be dealing with this. So whilst at other places people are slowing, getting over it, are slowing, their curves are flattening, etc. Africa appears to be peaking, and I think many things can be said for this. The positive thing in this is that we've seen how others around the world have dealt with it. So we now have the benefit of information and experience from learning from other people to be able to do it better. So we have recorded 6,806 deaths, not so good, but this compares better when you look at how Europe, for example, when they were at 250,000 cases, the number of deaths they recorded was significantly higher than this. So yes, that is how interesting thing happening in China as well. China is beginning to see a new wave of infections. They recorded 49 cases in Beijing, and Beijing is suffering some kind of a lockdown as we speak. And New Zealand, you recall, they had for about 24 days, they had 0 cases.
Yeah, and they declared themselves COVID-free.
And indeed, they were COVID-free until yesterday or so. 2 British nationals flew into the country and they only realized that they were infected. So it's ended their 24-day run of 0 infections. So now New Zealand has 2 new cases, and because of the country they were coming from, they were accepted from the mandatory quarantine requirements. So they were made to travel over 650 kilometers, etc. We only hope that the situation doesn't escalate there.
But it appears that, in most cases where we see countries coming out to say, "Oh, we're doing good now," we're in the case of you, and then something happens.
Yeah, I think it means that you don't have to rest on your house. You don't have to be complacent. The New Zealand case, I think, is just unfortunate because these are not internal cases. These were cases imported from outside. I don't know why they would exempt the UK nationals from the mandatory quarantine. But I'm sure the same way they handled it before, they will handle it again.
So it means that the people who entered were not put into mandatory quarantine?
Yes, some countries have some arrangements. So UK, for example, in many of the countries, when their citizens travel there, they are not subject to many of these strict
Is it because
rules.
it's expected that from their countries they went through a particular process before stepping out?
Well,
because if not, and you're just letting people go through because they belong to a certain country, then that's problematic.
Yes, it is. I think it's based more on the diplomatic ways of doing things, etc. Because if it's based on whether they have or they might have undergone a stricter system in their country, UK is not an example. UK is not a place you would think have, or you assume has strict measures, because they don't. I mean, they don't. So it's not a place to give such a concession to. I think it's purely based on diplomatic conversations, etc. And you recall when the US banned flight from many other countries in Europe, UK was accepted. So there are these things.
Yeah. Okay. So if we're done with the numbers and the
few global headlines.
Okay.
So COVID-19, the UK study hails breakthrough drug for severe cases, and they put a breakthrough in single quotes because they are being careful. So medical trials in the UK have raised hopes of a major step forward in the treatment of patients who are seriously ill with COVID-19. A cheap and widely available steroid, dexamethasone, has been found to increase the chances of survival for seriously affected people, and it cuts the risk of death by 1/3 for patients on ventilators. For those on oxygen, it cuts death by 1/5. And researchers at Oxford University, who call it a major breakthrough, say the steroid prevents the immune system from overreacting to coronavirus. The drug is just one of the several major global study of potential coronavirus remedies. So that's some good news there if it goes through. So also COVID-19 hits bank lending in East Africa. Certainly these are being felt across other parts of the continent. And then Magufuli, that's Tanzania's president, orders all schools in Tanzania to reopen. So Tanzania's president, John Magufuli, has ordered schools at all levels to reopen on June 29. Okay. He has also ordered a return to normalcy of all social and economic activities that had been stopped by the coronavirus restrictions. Mr. Magufuli issued the directives while meeting Parliament on Tuesday ahead of October's general elections. And he repeated his claim that his country was spared the pandemic by God, words that had elicited mixed reactions recently. Okay. So those are some of the issues happening. Also, Guinea is to reopen schools and places of worship. So gradually, everybody is easing up a bit.
The school and the worship thing is now globally taking shape.
But in Uganda, they have banned campaign rallies ahead of the elections. So at least they are taking some other measures.
Some interesting analysis coming from a study in the US suggests that people with underlying health conditions such as heart disease and diabetes are 6 times more likely to be hospitalized with COVID-19, and they have a risk of coronavirus-related death 12 times higher than otherwise healthy individuals. And the study also says that men were more likely than women to have bad outcomes, and the prevalence of hospitalizations and deaths were highest among patients aged 70 years and older, according to the U.S. Centers for Disease Control. So
it's a confirmation of what we've
known. So is that by analyzing data from over 1.3 million COVID patients between 22nd January and 30th May, the CDC found that the most prevalent underlying health conditions in more severe cases were cardiovascular diseases, so we have hypertension and other things, diabetes and chronic lung diseases. So, I mean, this is consistent with what we know in Ghana. And it's, when you look at the profile of people who have died, you realize that cardiovascular diseases and diabetes and lung issues have been the prevalent causes or related causes of death, apart from the corona itself.
Okay, great. Okay, so with all that in mind, let's come to Ghana proper and look at what we have. So like you said before, we have 12,193 cases. That's very high. We have of course, recovery standing at 4,326 and our deaths now at 58. So earlier, Dr. Patrick Kumar-Boakye spoke in a presser this morning. Let's see what he said on our cases. So we'll look at our new COVID figures as reported by authorities this morning.
As at yesterday, the report have in the total number of positives are 2,193 cases out of 255,971 persons tested at a positivity rate of 4.76%. Like I said, these numbers are the numbers that are from the first day that we had a case up till today, and we continue to add any numbers that are tested. And our policy is routine testing, which is those who report conditions, and then we also have enhanced testing where we are testing our contacts and also identifying at-risk groups to test them. We have 4,326 recoveries so far, but because there's new evidence about the behavior of the virus, and so we may be reviewing, looking at all the events to look at our discharge, so that we'll be able to get more people of who really do need our attention no more. We have recorded so far declared 58 deaths. The last 4 deaths which was added are all in Takra, 3 males and a female.
Okay, so that's Dr. Patrick Kumar-Boakye on the latest figures and all that, saying that routine testing, enhanced testing are some of the things they're still doing. And also they've noticed that the virus has taken a new turn as well. But the numbers, 12,193, very high within a space of 3 months and a few weeks or so. And us recently easing our restrictions, we've not even fully lifted everything, and seeing these numbers spiking by the day, by 2 days and all that, should we now relook at some of the measures we've put in place in terms of medically, in terms of economically, in terms of all these things that we considered in easing these restrictions? Or we're not seeing these figures based on restrictions, so we perhaps have to look elsewhere?
Well, the figures are what they are, at least from what official sources tell us. So 12,193, that is quite huge. We are told that we've tested 255,000 times. The number of tests, impressive. And so you've been able to discover more. The solution as we speak, I don't think is in locking down, because we've seen the effects of lockdowns, and we've seen how difficult it was for our economy, etc. In essence, lockdowns are meant to help the health system mobilize itself and try to contain the situation and restock and get ahead of the virus. I think we've done a bit of that. Where I think we are missing it is in our non-adherence to the protocols. The protocols are very simple things, and these are the things we are told you will do to get saved or to not get infected. So you try and keep social distance. You wash your hands frequently. You sanitize where you don't have the opportunity to wash your hands, or you can do both. When you are coughing or sneezing, you don't sneeze into people. You sneeze in a tissue or handkerchief, or at worst in the bent of your elbow. You do all those things. If you have nothing to do in town, don't go to town at all. You're not going to town means that you are not going to get into contact with other people. And given the nature of this disease, you can't tell from somebody's face that the person has it or not. Very influential people are getting it, very not so influential people are getting it, and downtrodden people too are getting it. So it's a disease that knows no bounds. I think what we have to rethink is our behavioral, approach to it. I don't know what can be done. I heard the president say it's an offense now not to put on a mask, etc. I also heard the Volta regional minister saying that he spoke to all the district assemblies and municipalities in the region to pass bylaws that will make non-wearing of masks, an offense. But we are not seeing enough of that. So in Spain, for example, if you are caught without a mask, you are fined instantly. I think it's 50 euros or so. On the spot, you are fined and you have to pay. When we introduce things like that, maybe we don't have to do 50 euros or 50 cedis, but there should be a certain level of seriousness. We are told police people are in town trying to enforce that. But it is as good as on paper. We just say that to make us look good, or to make us feel that we are doing enough, or to make people watching feel we are doing enough. But in actual fact, it is not the case. Go to town right now, you see a lot of people walking about without a mask. They don't even care about what social distancing is. You go to Medina, Zongo Junction, the people are so packed there, nobody even knows about this. You see people wearing masks, but they don't even wear the mask the way they are supposed to wear them. They wear the mask, put it under their chin, and they are heartily conversing with people. These are the things that give opportunity to the disease or the virus to spread. And unless we are ready to rejig these protocols and make them more enforceable, and indeed enforce them, I think we'll be joking.
Even.
It's interesting, but I think it's a difficult moment for everybody, because we've said that the world cannot lock itself down forever, and some openings have to happen, and so they're happening. But of course, the only thing we can do is that whilst you open up, you still open up cautiously and still live by the tenets that have been spelled for all of us, so that we all stay safe. Just that at this point also, it gets a bit disappointing when a certain impression, or the impression is created that government is not being forthcoming with certain things. Because, for instance, we've talked about the stigmatization conversation, and why it's important that people in certain high positions who may have come into contact with the disease should be able to come out and speak to the population, because it has an impact. You have no idea the impact it has. Because if there's somebody sitting somewhere who is far below the social class of, let's say, the health minister who had COVID, and hears the minister say that I have COVID, it kind of puts you in check that, wow, the minister has COVID. With all the protection he has it. So it means I can also get it. Now, I have said that, but for the media that put out this, we may not have heard it. Because the point is that the day the president said it was not the day the man got the COVID. He had gotten it days earlier. The STMA mayor who died of COVID, we didn't get that information, and the assembly itself was denying. And even we heard stories about the fact that when, for instance, the man's driver tested positive and was isolating, the man was still going to office and working. All these things, and it's sad when officialdom or people in places that should know better kind of fail us in how they handle things. It's unfortunate he had to die in the manner he died, and it's quite sad. But it just tells us that everybody is at risk. I am worried that as we are opening up and easing the restrictions, I don't know what we're doing with our health system, because if the numbers balloon to a certain degree, Vivian, that will be our undoing. For me, that's where my concern is. And I'm even more worried now because you have a lot of health workers who are contracting the disease. We heard, for instance, yesterday that the intensive care unit of Komfo-Anokye, they are working at half capacity because most of them have come into contact. I know some who have tested positive, so people are they're isolating and all that. We heard of the doctor at the SD hospital who has died. Very sad story. So in as much as we want to open up and do things, if we really leave some gaps, if we are not careful, we'll be finished. I'm careful about the claim by some people that the government appears to be massaging figures in particular, especially regarding the death. Occupy Ghana has said that. I don't know the basis for that, but a while ago I read a report by the GhanaReport.com, and reading that report, it makes me want to ask questions, and the government needs to come clean, because, for instance, they talk about the fact that the Ashanti region, as at the last updates that they sent to the headquarters, as in they sent to Accra, they had 38 deaths. But still, as of June 14, the death for Ashanti region on the slot among the 58 was still 14, thereabouts. And when I read the report, they quoted the regional health director, who says, well, the report as you have it is what we sent to Accra. We do not know what exactly happened, whether they do some verification and realize that maybe somebody didn't die of COVID or whatever. But I think it's problematic, and I think government has to come out and really clarify these things, because otherwise, because what it means is that per the calculation, if that story is anything to go by, then it means our deaths should be around 78 and not 54.
But really, on the ground, with regards to the figures, whether it's the cases, it's the death or whatever, are our figures really what they are? So, for example, if somebody died today, right, do we test to know whether that person died of COVID?
No, Vivian,
or somebody who, for example, was tested positive for COVID, let's say 2 weeks ago, dies, let's say this week. When that person is brought in dead from, let's say, home, do we test to know that this is COVID, or we leave all those, hanging?
Vivian, from what I know for now is that those they test, for instance, you came to the hospital with a condition, and we suspected it to be COVID.
Yeah.
We tested you, but then before your results came, you died. They've had those cases, so those ones, they are counted as COVID cases. If we test you because we suspect you have COVID, but before the results came, you died, they still carry on with the test. They even test some of the people. If they didn't test you when you died, they will still test you. That's what I am told.
Because we also receiving reports. There are certain people who have told us their relatives died recently. They were made to do the COVID test on these relatives who hadn't done any COVID test at all. There are also other people who are telling us their relatives died. They didn't do any COVID tests on them at all. Do you understand? So let's say, if God forbid, I died today, I will not be tested for COVID. But let's say, God forbid, you died, you'll be tested for COVID. So there's no real, rule that anybody who comes in, let's say a DIB or whatever, is tested. In some cases, hospitals will test. In some cases, they will not test. So it brings to question really the figures we have in terms of deaths and all, whether it's what is really reflected on the ground.
I don't know what other countries are doing, but I mean, the point is that before COVID, people were dying anyway. And we don't want to assume that everybody who dies would have to be tested for something COVID. And I think that, that would be a challenge in terms of logistics. I don't think, because the point is that even we who are living, all of us have not gone through mass testing. So why do you want to test everybody who has died? So I think what they are doing is that once they suspect you have COVID and then you die, they're still able to test. Or maybe when they tested you and your results didn't come, when it comes and you died of COVID, that figure is added. That's what I heard the Ashanti Regional Health Director say. So it's still a bit confusing. I really want the government to really respond to that.
Because the issue with the testing of the people is, the COVID burials are different. Right? And they have to be done a particular way for health reasons.
It's true.
So if not, and people are dying and we don't go through certain protocols, the barriers we are doing, then they are problematic, right?
I think that's a genuine concern.
Yes, what is important is we have consistency, what the protocols are. So, for example, any death recorded, if, for example, the protocol is any death recorded must be tested, that's fine, but that is a Herculean task.
Yeah.
What I think is happening and should happen, and which we need to have clarity on, is the fact that if the person dies and relatives say or are asked what symptoms the person manifested before the person died, and those symptoms, fall within those of COVID-19, then I think it makes sense to test. That is important. Indeed, it makes sense to test because it helps the people who were with the person before the person died, and it saves everybody, because the way the body is taken care of or is handled is important. That should be different from how other bodies are handled, because we understand it could still be infectious at that stage. So it is important that we have clarity on that. But I assume what's happening is that they will look at the symptoms the person presented before the person died. Even if the person died at home, they have to look at the symptoms the person presented before. Then we do this. Testing everybody
it's difficult.
It's difficult,
even
especially because the test average we have around between 100 and 150. So maybe roughly, let's say for purpose of argument, $100. We said we've tested 250,000 people in Ghana. Multiply 250,000 by 100. That's 25,000 US dollars. It's not cities, US dollars. That's a lot of money. That is around 100 million Ghana cedis or more. That is a lot of money government is using. So all this money is being spent.
What about the test kits that people have been pushing for all this while?
Yes,
Why
so
are we finding
the test
difficult
kits are
to bring
still
them
at
in?
the FDA stage. I assume that FDA hasn't spoken about it because maybe it's not meeting a certain standard. And given the energy and the drive and the innovation we saw in the early times, maybe the few coming out to say they did not meet the standard or purpose, it will be discouraging to the Ghanaian ingenuity. I don't know why. But we need FDA to pronounce on that. The KNUST INCAS one they did. We need to hear something on that. The difficulty, I'm a big advocate for RDTs, but the difficulty with that has to do with what we call the sensitivity and the specificity. The ability for it to pick out the specific pathogen, the coronavirus that causes the COVID-19, that could be an issue. And also its ability not to give you false positives or false negatives. That is also key. So you don't want a situation where you will test a lot of people thinking that they are this, but only to realize that a good number of them are that, maybe negative or positive. So the one we are doing now, which is a PCR, provides, a more accurate result than we have for the RDTs. But people have also argued that there are IDTs like MOS and others they've mentioned used in other advanced countries which are as good as the PCRs. And they are not at the authorities must re-engage on this, because at one of the press conferences I heard Dr. Nsiasare, advisor to the President on Health, say that they're going to introduce the RDTs. I think they've gone too silent on that, because when they said it, they raised expectations of people. We need to have a follow-up conversation on that. They need to come back to us to tell us that we are not doing the RDTs because of A, B, and C, so that we know what to do. But to leave us in the dark like that, I don't think it's proper.
The talk of Dr. Anthony Nsiasare, I want us to go to him. And this morning he spoke about this massaging of figures that has been a conversation for a while. And let's see his response on that.
Policy level, we all get the figures as you are getting this morning. So we don't generate any figures from the policy level. The Presidential Task Force, and that matter for the presidency, doesn't generate any figures. There is implementing agency. So this COVID-19 fight is led by Ghana Health Service, the teaching hospitals, and the Minister of Health is the policy who is also organizing them. And then we have a Presidential Task Force. The presidency doesn't generate any figures. We see the figures as you have seen here today. And then we then use the figures. he has shown you exactly the regions and the discs where all this, where we're having the COVID-19 cases. So we then target the regions and the districts we have to send resources there. So I want to repeat once again, we don't generate any figures, we don't manipulate any figures at the presidency, or for that matter, at the presidential task force level.
Okay, so that's its response. The figures are not generated
anywhere. The response is inadequate. The response is not sufficient. So if you don't generate, well, maybe he's speaking for the presidency, but the issue necessarily is not about the presidency. Yeah. It's about the whole chain. So he is saying that, look at what he was trying to do, trying to absorb the presidency or the Jubilee House from anything, if there is anything untoward at all, but leaves the other ends loose. Yeah. That it is the health service, the Ghana Health Service, that generates or that manages or that deals with the figures. They are also told the way we are told, absorbing the presidency from everything. But nobody is saying the presidency. Yeah. That is a suspicion, of course. It remains a suspicion. The suspicion is that the system, whoever comprises or makes up the system, is the system. The system may be manipulating or massaging the figures. What explanation does he have for the Ashanti Regional Health Services report that some 38 people from Ashanti died within a certain period? But in the national representation, we saw just 14 for Ashanti. He did not explain that. So once he's now unable to explain that, his explanation is neither here nor there. I'm not convinced. It's insufficient. He was only seeking to protect where he batters his bread from. And I think in this time, that is the last thing we should consider doing.
Okay, the report I'm talking about, the GhanaReport.com, and it's titled Exclusive, Ghana's COVID-19 death more than what GHS reports. And it's a very long report. In part of the report, it says that we have a total, it says, the document revealed that the Ashanti regional reported cases should be 38 and not 14 as contained in the national situational report. So apparently the regions send their reports. So they send the 38 people have died in the Ashanti region. And the website adds the report. They actually have a photo of it, and they've added it to the report, and it states the number of people that have died in the Ashanti region. And I can see clearly it's stated here. This is June 13. Total cases today, as of June 13, the Ashanti region, 117. Cumulative 2,205. The deaths, 5 today, then cumulative 38 deaths, then recoveries and stuff. So they conclude that if you add the true picture of the Ashanti region deaths, as they have it here, our death should be around 78 and not 54 as we have it. And in this report, they quoted the Ashanti Regional Health Director, where he was saying that, well, the report as you have it is exactly what we have here, and we send to the headquarters and they do the collation. But we do not know whether figures change there. And also it's a bit difficult because there's no way a figure should come from the region and change in Accra.
But why should the figure change?
Because it is the hospitals that record the deaths and the cases. It is not the region. It is not so you cannot even change a figure that comes from a region to Accra. Unless the same region tells you that, okay, maybe the figure we gave you, we found out that this was inaccurate, so correct this. But if the region hasn't given you that information and what they gave you doesn't reflect, then it becomes a question. I think this is an important issue. The government or the health ministry, the Ghana Health Service, they have to respond specifically to this claim because it's a serious claim. It's a serious indictment on the government. And so we need a proper scientific explanation to tell us how this didn't get there, and we still have Ashanti region showing less deaths and not 38. So
you see, the danger too in this is that now we are all rallying behind the government, believing that what they tell us is right. And so based on what they tell us, we modify our behavior and try to do what they tell us and try to do what is right. This is Ashanti we are seeing, unless of course they're able to tell us that the figures as we are seeing from Ashanti are not correct and that theirs is correct, or this also was presented, but upon further checks and interrogation of the figures, it changed for whatever reason they may justify. But until that is done, we stand the risk of eroding the confidence and the trust we have in the system to give us good and accurate data. That is very important, because in fighting pandemics, the last thing you want to do is to have mistrust between you, the system, and the people. Because the decisions you make will affect the people, and the people, you need the people behind you to do what you're doing. This is just Ashanti. What is the case in the Volta region? Even in Greater Accra, what is the case? So if this Ashanti situation is correct, then the logical thing for anybody to do is to assume that the same way the figures are being massaged, allegedly, in Ashanti, same thing is happening in Accra, same thing is happening in the Volta region, same thing is happening in the northern region, etc., etc., etc. When we get on that path, I'm afraid we'll be losing this fight.
So we hope that in the coming days there will be a proper response to this issue. But remember, at the beginning of this, we had a similar challenge where the website wasn't reflecting what exactly we were being told at the time by authorities when they started the process. Well, you see, they'll mention a figure, when you go to the website, it's something else. And it happened for a while till there were a lot of agitations, and then we saw a change in that. I don't know whether I'm sure that is what is happening, or this, in this case, is a deliberate one.
But this is June 13, according to the CITREP, as in the situational report from the Ashanti region. That's June 13th. Today is 16th. If it's an error, it's an error. We should expect that it should be corrected by now. So it's a bit questionable.
Okay. All right. So another issue that has come up is the contact tracers who are agitating over the reduction in their per diems, among others. Let's quickly see the reaction of the authorities on that, and then we'll quickly look at that and move to other matters.
When we started lockdown, we recruited 1,000 volunteers who are not our staff to do contact tracing, because we wanted to ensure that the health sector is still buoyant enough to receive any cases that come in. So we didn't use our own contact tracers. Prior to that, we were using our own contact tracers. It was for 3 weeks, and those were the ones who were paying the amount of money. After the lockdown, we reverted back to using our own contact tracers. Some two districts, one in Ashanti and one in Accra, continuously use them, and that's where there are issues that we are trying to resolve. But currently, contact tracing is ongoing. In the 4 other regions, they have not used volunteers. In Greater Accra, now they are in Ashanti, they are using our local volunteer, our own staff to do contact tracing. So contact tracing going on. That is why we continue to report cases. If you are not doing the contact tracing, we're not finding any cases. Otherwise, we're waiting for people who are to come and teach them. So that thing is not. But you see, we are also doing risk assessment. That's why we're doing the enhanced contact tracing. We go some risk groups, we go and assess them. Certain categories done, and those are all ones done by a contractor. Once you have a positive, your contacts are listed, and the team goes. When we have a surge in particular districts, we call it, we get that contact tracer from the neighboring district to come in and assist if there is a surge. So we really have not had any reduction in our contact tracing efforts.
Okay, so that's a response to the contact tracing matters. You guys want to comment on that?
I don't know if I didn't get him clearly, but I think what he meant was that those who were promised, I think the 150 cedis a day, right?
Yes.
He says those ones were the people who are not Ghana Health Service staff. They were volunteers. They recruited about 1,000 of them or so for the contact tracing for about 3 weeks. And those were the ones who qualified for the 150 per day. And I think that's the explanation, that the understanding I got. But then he says that those people have been done with because, of course, the contact tracing duties have reduced. So now they've reverted to most of the places. They are just using their own staff to do the contact tracing. So I'm sure that is where they may have now revised the amount. Yeah. So I think that's because, of course, those who are now, if they are now normal staff in the Ghana Health Service, it means they are already employed workers of Ghana Health Service. They are on salaries. I assume that as health workers, they're also enjoying some of the tax reliefs government gave. So they maybe, if they are using you to do additional contact tracing, then they may not want to treat you with 150 cedis daily like they brought a volunteer who is not a staff, because that person doesn't enjoy that thing. So maybe, I think that's the idea. So, but probably it's the communication. Maybe they didn't communicate properly with those who they used in-house from the beginning. That's where the issue may be coming from. But I hope they will find a solution to that and they'll be able to rectify it.
I don't know what Eben is trying to explain.
I'm only explaining.
He's massaging the
Explaining what the man said. And I'm thinking that.
I mean, let's call it what it is. Dr. Kumar Boaji, I think he's a good guy, but he's not your best of communicators. He's never been succinct with his information, how he communicates. So when he speaks, he leaves more questions than answers. And that is not correct. If you're a leader of a big institution like the Ghana Health Service, you should be able to communicate clearly so that when you leave, you don't leave a lot of questions behind. Exactly what he has done again. We're talking about contact tracers, 150 CDs per day, 70 CDs per day. Now, we don't even know what he said. You understand? We don't know what he said. He's never been very succinct and very precise in his communication. I mean, the solution for me is simple. If you engage people, and so I didn't understand what he said. So if you engage people, you make them a promise that based on when you do this, I will pay you X amount. Based on that promise, the person delivers a consideration or the person gives off something. And so you have a contract. So if I do my part and it's left for you to do your part and you don't do it, you have breached their contract. If they should go to court, if the issue is how we are seeing it, unless it is not as we see it, they should go to court and vindicate their rights, get the court to compel government to pay them. Because you say you are paying me 150 CDs when I do ABC. I have done my part and you are not paying me. And what are they telling me? They are not saying that maybe we don't have money now, we will pay later. We are not hearing that. But I don't even know what he's saying is that they are finished with those people and so they've been paid and they've left. If they've been paid and they've left, why were they agitating?
Why were they agitating?
And you see, the situation is not just limited to these contact tracers. You recall a few weeks ago, the guys in Nuguchi also had a similar concern. So I fail to understand what he's saying. I mean, we need to have clarity on this. The explanation he gave didn't help the matter. He didn't do anything to the matter.
And I think all these things, they somehow paint the government in a certain light that we have diffused the importance of the fight against COVID.
Of course.
When you do these things, that's, for instance, this particular issue, how they handled the health minister's case, even the press conferences. If you notice, for some time, it wasn't as frequent as, our cases were going up.
The last time we had the conferences was a day before the floods. After that,
you see, when all these things are happening, they give a certain impression that the government itself is relaxing. And you see, and it helps your political opponent to begin to preach, the propaganda about the fact that, well, all these things we are doing is towards election strategies, trying to open up for registration of voter registration. It gives that kind of, impression. So I think that the government needs to tighten these loose ends. It's not helping because the cases are increasing, and before we know, if it gets to that astronomical level, I'm just worried about our health system and what it can hold. Because now when you look, I get worried because initially when this thing started, if you go to the Ghana Health Service website, you notice that the critical cases or the severe cases mostly. You see 2, you see 3. Now, when you go, currently the critical is double digits. 16 critical. And those 16 severe, and then the critical ones are 6. And I can tell you that by the 6, I'm not a prophet of doom. But the 6 you are seeing, by this week, some will go down. So the death toll will keep rising. And we need to be careful. It's a serious matter.
And he also said, so Dr. Kwamba just said something, that they have reduced the number of contact tracers, so they are not doing contact tracing as before. The question is, when the figures were smaller, you deployed a very aggressive contact tracing. Call it enhanced contact tracing, specific to our situation. Now that we are recording huge daily infections, you have rather cut down on the number of contact tracers. I don't understand it. This is the time we should rather be doing more contact tracing because the figures are going up. And a lot of the figures are from routine surveillance. And we have heard them complain that so a lot of the people come to the hospital when the situation is terribly bad, and that it takes them, that they arrive at the hospital after 24, 48 hours, they die. It means a lot of people are in the communities
Yeah.
Where, they are infecting other people because the situation is worse. They are sick and they are not seeking healthcare. What is happening to the people who lived around them? People move from place to place because the restrictions have generally been lifted. So people travel here and there. They sit in cars, they go to places, they talk with people, etc. This is the time for people to do more contact tracing.
It's not happening because we've had reports where people tested positive. They were told that self-isolate will do the contact tracing until today, 2 months, a month.
Let me deal with another matter too. About contact tracing. The Communications Ministry launched an app they said was going to facilitate the contact tracing so that if you are infected, there's a way your information was entered into the app and people you've had contact with will be known and etc. When I heard it at first, I said, fantastic. That was what Korea did. They used their GPS and their phone information and things to trace people. So if people who you have called or you went, the credit card information, etc., you went to some places and did all sorts of things. Once you are infected, they confirm that. I hear an alert is sent to people you might have contacted and they know. So they also go and test or isolate. When I heard this, I thought that was a similar thing we were going to do. It was just a fanfare. It was just a fanfare with stars, etc., like we do, like we always do. Fanfare. Weeks after the launch of the so-called app. I don't know what the contribution of this app has been to the fight. The contact tracing. Zilch, because we've not been told anything. And Vivian, I'm sure if this app was working and doing well, we would have been hearing it every day because it's an achievement. We would have been hearing it every day. The Communication Ministry people should come and tell us what the contribution of this app has been. The tracker app has been to the fight. Of course, we are told that it was designed for free, no problem. But once you launch it and you give us the expectation or the hope that this will help in the fight, we also deserve to know how it is helping in the fight.
Okay.
Simple.
That is the concern is being raised by one of our viewers, Niashi Lai from Adaraka. He says, good afternoon, please. What happened to the tracker app that the government launched 2 months ago? Is it that it couldn't stand its purpose? He asked. So I think we need to follow up on that tracker.
Communication Ministry.
Yes. Then this one says, a doctor, this is Nana, a doctor with the COVID, okay, I'm not understanding, but let me read what else he or she says. Now, good afternoon, Vivian. With respect to the number of deaths, once you are suspected to be a COVID case, you are tested. Even when you die, you are not only added to the death figure if your result comes back positive, okay? Once a confirmed case dies, the relatives first have to be informed, but it is added to the statistics. This doesn't always happen the same day. This doesn't always happen the same day the person dies because there may be genuine reasons why the relatives may not have had the news broken to them yet. This is also a process. As for the rapid tests, please, the sensitivity and other things around it are very unreliable. Hence, it is not the best thing to do now. Not at this stage when the numbers are increasing. RDTs will be good at some stage, but not at this particular stage of the disease, please. The truth, though, is that there are often unusual delays in updating the figures. Okay. This one says, in fact, as a nation, we seriously need to look at reopening schools again and again. Let's not get there before we regret this, because we are very much going to regret it if schools reopen and we don't do so with the measures. Okay. Now, this one says, everything is showing that the government chose politics and power over the lives of the people. If a whole health minister who tested positive denied it, then we are not safe. The EC should listen and not endanger the lives of Ghanaians by moving from one jurisdiction to another just to register for new voters card and get COVID-19. Okay. This one says the GHS director, as a matter of fact, is not on top of issues. Contact tracing is now about 20%, and the remaining cases are those confirmed on admissions at various hospitals. Okay. This one says, please do us a favor by giving us updates on the COVID-19 test kits. I think we've said, so we'll check it and then get back. We really need this at this time. Okay. And then this one says, About the contact tracing, I disagree. Actually, more contact tracers are needed now more than ever. This is because we now have more cases emerging in communities that are more difficult to reach. Tracers meet more resistance of late, some being chased out of certain communities, and the number of contacts are more. More people are needed to trace and trace quickly to make our work easier in the treatment centers. Also, some Noguchi staff have actually resigned and gone home. Some testing labs have also run out of consumables. I think this one, another one says, I think the system is cash-strapped. How on earth do you pull health directorate staff who are supposed to be performing other duties now to do contact tracing? No wonder our test numbers keep decreasing. This one says, okay, this one is giving you guys for hitting hard.
but Lillian, okay. That's an interesting point.
On the cash
it's an interesting point because Salom made the point too, that our cases are going up. Community spread is now higher. And this is the point we have reduced contact tracing. And so the point the person makes, and like they said, the staff at the hospitals or directorates
used to go and do contact
so it means that
tracing.
at that place it's a bit dangerous. And the point is that at this point, every country is taking a risk, but we must measure our risk we are taking carefully. Else, when it boomerangs,
we will rank.
We will not get a place to hide.
Rank and boom. Okay,
yes. I want to spend my final moments on the show to pay special tribute to former boss, Dr. Lydia Selby, who was tested positive for the COVID, and I spoke to her. She's in high spirits.
That's the NHI boss.
Yeah, yes. The NHI boss. She's in high spirits, and she's determined to break the stigma. Okay. So because of that, she's begun speaking about it, and I think that's very impressive. And if a lot of
something the health minister should have done.
A lot of the privileged people in society, a lot of the powerful people in society, because this disease knows no bounds or class. When these people begin talking about it, and begin assuring people that it is not as we thought. When you take your medication, when you do this, you'll be fine. And they are recovering, and there's proof that they've recovered. I think the stigma, to a large extent, will be dealt a heavy blow, and that's what we want to do. So I want to wish her well. We are praying for her, that she comes back stronger, and I hope she keeps a diary of her daily recovery journey, so that when it's all said and done, it will be shared with all of us, so that we will know exactly how the process has been. So we wish her the very best, and we hope that God, delivers her and heals her in this.
We wish her, and we know she'll pull through nicely. All right, gentlemen, thank you so much for joining me today. Eben Afeni-Dazi is head of the City Business News Desk for TV and Radio, and Selom Adono is also head of features and articles here at Citi FM and Citi TV. My name is Vivian Kai Loko. Thank you so much for joining us. See you another time.